friends, I am Dr. Pratibha, consultant gynecologist at TenderPalmHospital, Lucknow. Today I am going to tell you about cervical cancer. As all of you know, January month is celebrated as Cervical Cancer Awareness or Prevention. So, theme of this year is also learn, educate, and vaccinate the females to prevent cervical cancer. Cervical cancer, what it is, its causes, and how we can make the diagnosis of it. Cervical cancer is the second most common cancer among the women in India after breast cancer. Around 1 lakh of the women in India are diagnosed every year with cervical cancer, and out of which 77,500 die because of the cervical cancer. Cervical cancer occurs because of the long-standing infection with human papilloma virus in sexually active females. Because of the lack of awareness and unprotected sexual intercourse, in spite of easy availability of the condoms, the awareness is not there. Because of that, they are acquiring persistent infection with human papilloma virus. Human papilloma virus infection at the cervix. Cervix, which is the lowermost part of the uterus, connecting to the vagina. Around the cervix, because of the persistent infection with the HPV, they undergo proliferation and metaplastic changes, which later on converted to neoplastic changes, means unproliferated, uncontrolled growth of the cells at the cervix, which develop into the cervical cancer and develop mass or tumor-like cells around the cervix. Approximately in the reproductive age females, approximately half of the females acquire infection with HPV. In spite of so prevalent infection with HPV, only a small fraction of the females develop cervical cancer. Cervical cancer risk factors. Who are at risk of developing cervical cancer? Because of the women having persistent infection with human papilloma virus. Even male can also get infection with human papilloma virus, and though they don't have the cervix, they develop infection and cancer at the penis, oral cancer, mouth cancer, and also cancer of the anus also. Human papilloma virus, there are various strains of human papilloma virus, but only two strain 16 and 18 are responsible for development of the 80% of the cervical cancer. Two most common type of the cervical cancer are squamous cell carcinoma, which is responsible for 80% of the cervical cancer, and adenocarcinoma, which is around 20% it causes cervical cancer. Symptoms and signs of cervical cancer. Unfortunately, symptoms and signs of cervical cancer appears once the disease is progressed and in late stage we diagnose. Symptoms and signs are basically menorrhagia, postmenopausal bleeding, dyspareunia, foul smelling, dirty discharge, anorexia, loss of weight. All these are the symptoms of cervical cancer. Early diagnosis better with the prognosis of the disease. And how to prevent with the cervical cancer. Cervical cancer can be prevented by vaccination of the young girls and reproductive age females with vaccines. There are various vaccines available, quadrivalent and nanovalent vaccines are also available, and vaccination can be started as early as 9 to 14 years of the age group or before attaining sexual contact. Screening of the disease once the females are sexually active at a regular interval, like every 3 years, or who are at risk every 1 year, we can screen the patient with pap smear and liquid-based cytology, and even detection of HPV infection, HPV virus in the cervix, and treatment of the pre-malignant lesions like chronic cervicitis, PID, pelvic inflammatory disease. As soon as it is diagnosed, we can prevent the cervical cancer. Stopping of cigarette smoking and use protective sexual intercourse. By this we can prevent the cervical cancer. Thank you.